We're now on the record. Today is July 13th, 2023 at 1:51 p.m. Will the court reporter please swear the witness?
Please raise your right hand. Do you solemnly swear or affirm the testimony you're going to give in this cause to be the truth, the whole truth, and nothing but the truth?
Yes.
Thank you.
All right. Good afternoon, Dr. Gregory. Will you please introduce yourself to the jury?
Hi, my name is Stephanie Gregory. I am a pediatric neurologist at WellStar, and I am the treating neurologist for Kendall Thomas.
All right, thank you, doctor, for taking the time away from your practice to be here today. So today we're going to cover three subject areas. We're going to talk about who you are, Kendall's treatment, and Kendall's future. Does that sound good to you?
Yes.
All right. So I think you just mentioned this, but will you tell us what kind of doctor you are?
I'm a pediatric neurologist. I'm board certified in neurology with a special qualification in child neurology. I'm also an epileptologist and have a board certification in epilepsy, both through the American Board of Psychiatry and Neurology.
Could you tell us what a pediatric neurologist does?
Pediatric neurologists treat all different disorders and diseases of the brain and central nervous system, as well as the peripheral nervous system. Specifically, I specialize in epilepsy, but I also treat patients for headaches, concussions, traumatic brain injuries, neuropathies, developmental delays, and any other disorders that might relate.
Thank you. And what made you choose pediatric neurology?
So I actually started my residency training as an adult neurology resident. I became interested in the brain and neurologic diseases when I was still in high school, and my grandmother had a stroke and had Alzheimer's disease. So I started thinking about that a lot more, and then in college I majored in neuroscience and then pursued medical school and a neurology residency. And then when I was in residency, I realized that I enjoyed my time with children much more. So I switched over to a pediatric neurology track and have continued on that.
Great. And can you please just walk us through your educational background?
So I did my undergraduate work at Emory University in Atlanta, Georgia. I was a double major in neuroscience and behavioral biology, as well as dance and movement studies. And then I attended Duke University in Durham, North Carolina for medical school. After that, I went up to New York. I did my intern year at Mount Sinai West in internal medicine for a year, and that was before I switched over to pediatric neurology. And then I did a subsequent 5 years of training in neurology and pediatric neurology at Columbia University Medical Center. After that, I moved back down to Atlanta, and I did a 1-year fellowship in epilepsy and a second fellowship in clinical neurophysiology, both at Emory and Children's Hospital of Atlanta.
Great. And what did you do after your fellowship?
I took a job at WellStar as one of the pediatric neurologists and epileptologists.
How long have you been practicing medicine in Georgia?
I started practicing medicine as a fellow in 2019, in August 2019 in Georgia. And I've held a Georgia license, medical license since that time. Independently, as an attending physician, I started practicing in February 2022.
Okay, at this time, the plaintiffs will tender Dr. Gregory as an expert in the field of pediatric neurology.
No objection.
All right, Dr. Gregory, before we get started, will you agree to give any opinions today to a reasonable degree of medical certainty?
Yes,
Okay. Dr. Gregory, do you know Kendall Thomas?
I do.
And how did you come to know and treat Kendall Thomas as a patient?
Kendall was referred to me by one of our neurosurgeons at WellStar named Dr. Benedict, and he referred her to me to manage her seizures and anti-seizure medications. and that was in August 2022.
Okay, and are you currently treating Kendall?
I am. The last time I saw Kendall in the office, it was June 14th, 2023.
What are you currently treating Kendall for?
I currently manage her post-traumatic epilepsy, and I treat her with anti-seizure medication, and I also have continued to prescribe her gabapentin that is used for neuropathic pain.
Okay. And what are you doing to manage the epilepsy?
Kendall comes to see me every 3 to 6 months, and I assess if she has had any further seizures, if she has any side effects to the medications, if her weight has changed, which would require a new dose of medication, and I make sure that she's in getting her therapies, although her therapies are taking place at CHOA, and just make sure that there's no other neurologic concerns.
Okay. And I want to take a step back. If you can just describe what epilepsy is for us.
So epilepsy is a disease where a person will either have at least 2 unprovoked seizures or 1 unprovoked seizure and a high risk, thought to be greater than 60% chance of having another seizure. And in that case, a diagnosis of epilepsy can be made.
And has Kendall had any seizures?
Kendall did have a seizure in summer of 2022. From my understanding, I wasn't treating her at that time, but my understanding is that she was in rehabilitation at Children's Hospital of Atlanta, and her prophylactic Keppra was weaned off, and she had a convulsive seizure during that time.
Okay. How does one get epilepsy?
Epilepsy is really an umbrella term for many different causes of seizures. So some people are born with a genetic abnormality or a brain malformation that puts them at risk for seizures. Some people get them from head injuries or traumatic brain injuries or strokes. Anything that causes damage or an abnormal functioning of the brain cells can cause seizures and epilepsy.
Okay. And how can you tell whether epilepsy is genetic or caused by something like a TBI?
So you have to look at the whole patient. Small children who have normal MRIs, or even older children with normal MRIs who have classic types of seizures or developmental delays in some cases, will be more likely to have genetic causes. Patients who have abnormalities on their brain imaging are said to have a structural reason for their seizures. And we also look at the time course that the seizures started. So if they happened after a particular brain injury, it would be more likely that it's related to that brain injury. So we look at the whole patient and make that assessment on why they have epilepsy.
Do you have an opinion about what caused Kendall's epilepsy?
Based on her history of normal childhood development and the correlation with the traumatic brain injury, I believe that it's due to her traumatic brain injury that she sustained.
Okay. And earlier you mentioned gabapentin. Are there any other medications that you're prescribing to Kendall?
So the primary anti-seizure medicine I prescribe to Kendall is called Keppra. Gabapentin is also an anti-seizure medicine, but not a first-line medication, and that's really I'm prescribing to help with neuropathic pain. She came to me on gabapentin, and it has been helping her, according to her parents. So I've continued to refill that, but the primary medication that I treat her with is Keppra for her seizures.
Okay. And how are those drugs administered?
She gets them in liquid formulation through her feeding tube.
Okay. Has Kendall had any seizures since she started taking Keppra?
She has not had any seizures since she's been on Keppra, as far as I'm aware.
Will Kendall's treatment change at all in the future?
That's hard to know for sure. Fortunately, right now, her seizures are controlled on Keppra, but in the future, she may need higher doses, or if Keppra doesn't seem to work for her anymore, then she may need other anti-seizure medications in the future.
Thank you. And have you done any procedures on Kendall?
I have not done any procedures. I discussed with the parents doing an EEG, but I don't think that it's clinically needed at this time because if the EEG is normal, which it can often be in patients with epilepsy, I would still want to continue her medication. And if it's abnormal, it doesn't give us anything else we need to do right now. So I plan to do an EEG when she's been seizure-free for about 2 years to see if it's safe to try to wean her off of her Keppra. So I haven't done that yet. I have referred her for neuropsychological testing to get an updated evaluation. She had one when early in her course, but I think it'd be helpful to reevaluate her cognitive function and abilities to help support her.
And can you just explain what is an EEG?
So an EEG is an electroencephalogram. It's used in neurology very frequently. We put electrodes on the scalp and record the electrical activity of the brain. And when people are at risk for seizures, sometimes, again, not always, but sometimes you'll see abnormal electrical activity in the form of spikes or sharp waveforms that indicate that the brain is at high risk to make seizures.
Okay. And doctor, how many times have you seen Kendall in total?
I have seen her 3 times.
And do you have plans for any future visits?
Yes, she should be scheduled for sometime this fall.
Okay. And what happens when Kendall turns 18?
When she turns 18, I continue seeing patients until they graduate from high school. So sometimes it's 18, sometimes it's 19, but then she'll need to be transitioned to an adult neurologist in the area.
Okay. After your visits with Kendall, do you ever send her and her family home with homework?
I recommend that they continue working on the therapies, but I am not involved in those specific therapy recommendations. I recommend that they continue taking their medicine and following up with me.
Okay. And has Kendall's family done the things that you've told them to do?
Yes, absolutely.
Okay. So now we'll talk about Kendall's future. How's Kendall doing now?
Kendall's doing much better than when I met her. She's made tremendous progress in her functioning and abilities, but she's still severely disabled, both physically and cognitively. She's still wheelchair bound. She is able to speak in very brief sentences, but they are disfluent and dysarthric and difficult to understand. She is able to follow simple commands. These are all improvements, but she's still very disabled.
Thank you. And how have Kendall's injuries interfered with her normal life?
So prior to the injury, from my understanding, from what her parents told me, she was always developmentally on track. She didn't need any extra therapies as a child. She met her developmental milestones. She did well academically. She was an A and B student prior to the accident. She played on the men's football team in her high school, and since then, since the accident, her life is completely different. She no longer participates in sports. School is more of a routine than an actual academic exercise. She spends a lot of time in therapy, trying to regain some of her functions. She's no longer independent in any of her activities of daily living. She requires around-the-clock care and full assistance. She, for example, isn't able to toilet herself. She doesn't know when she needs to urinate or defecate, so she has to use a diaper. She doesn't ambulate. She's in a wheelchair. So her life is dramatically different from my understanding.
Thank you, Doctor. What are some things that Kendall's parents have to do for Kendall that she can't do now?
They have to do pretty much everything for her. Like I said, they have to change her diapers. They have to move her in and out of the wheelchair. They have to bathe her, dress her, administer her medications, and her feeds through her feeding tube. She's completely dependent on all of her activities.
Do you have an opinion as to what caused Kendall's brain injuries and the limitations that you just described?
From my understanding, I again only met Kendall in August 2022, but the injuries that were sustained during the accident were severe enough to cause these types of disabilities, and her brain imaging shows scarring and long-term damage after the accident that is in keeping with her neurologic deficits and disabilities.
And if you can just tell the jury, what are some things that Kendall likely won't be able to do in the future?
So Kendall was hoping to go to college. Her mom said that she was hoping to attend NC-A&T in North Carolina and wanted to become a veterinarian one day. I think it is unlikely that she will achieve academic abilities enough to follow through with attending college, so I think that's unlikely. I don't think she'll be able to perform competitive sports at any level again. Simple things like driving or raising children, I don't think will be possible for her. I suspect that for the remainder of her life, she'll require significant care and assistance with her activities of daily living.
Thank you, Doctor. What's the probability that Kendall will make a full recovery?
So we can never predict in certainty, but based on her brain imaging and her exam, and the fact that it's been a year and a half since the injury, and she's still very disabled, I would expect that it is almost certainly, she is almost certainly not going to make a full recovery. I would say 0 to 3% chance of making a full recovery, if that.
Okay. And Doctor, I just have a few more questions for you. Are we paying you to be here today?
No.
Why are you here?
So Kendall came to me in August, and I first heard about her from Dr. Benedict, and he was very invested in her care and how incredible her parents had been at supporting her. And then I met her, and her family's really an inspiration for how they're taking care of her and handling all of this. And the situation is really heartbreaking that they've had to go through. And so the least that I can do is come and share my medical evaluation.
Thank you, Dr. Gregory. Those are all the questions I have for you.
Offer for 211.